2025 Headmaster mandatory skill. Performs catheter care on a female resident with an indwelling catheter with hand washing. Knock on the door. Greet and address the resident by name and title. Introduce yourself by name and title and explain the procedure. Ensure that the bed is in a low safe position and that the head of bed is flat. Ensure that the bed wheels are locked. Place the call light within the resident's reach. Provide privacy by closing the privacy curtain. Ask the resident about their preferences. Apply hand sanitizer to hands and rub your hands together until they are completely dry. Gather supply items. You will gather a total of 8 items, including the clean barrier. You may use a towel or a chucks pad. Place the clean barrier on the overbed table, then collect the remaining supplies and organize them on the clean barrier on the overbed table. You will collect a bath basin, 1 pair of gloves, a linen protector, either a chucks pad, towel, or waterproof pad, 3 washcloths, and soap. It's a good idea to organize your supplies on the overbed table in the order in which you will use them. This will prompt you as to what step comes next. Fill the basin with moderate temperature water. You must test the water before you allow the resident to test the water. You can test the water at the sink while filling the basin or when you return to the bedside. You may test the water with the finger, the underside of your wrist, your elbow, or with the gloved finger. Once you return to the bedside after testing the water, allow the resident to test the temperature of the water. Raise the height of the bed to a comfortable working level for yourself. Ensure that the head of bed is flat. Don clean gloves. Prepare your linen protector by unfolding it and rolling it away from you. You may place the linen protector underneath the resident's buttocks and peri area 2 different ways. I will demonstrate both ways in this video. Ensure that the linen protector covers completely underneath the resident's buttocks. The first method to place the linen protector is to manually raise the mannequin's hips, as I'm demonstrating now. The second method is by turning the resident on their side. Raise the side rail on the same side that you will be turning the resident. Prep your linen protector by unfolding it and rolling it away from you. Flex the resident's knee to prepare them for turning. Tell the resident what cue you will use to assist them to turn. Give the cue. Slowly and gently turn the resident onto their side, ensuring they do not become overexposed. Line the linen protector underneath the resident's buttocks and peri area. Slowly and gently return the resident onto their back. Pull the linen protector through on the other side. Double check to ensure that the linen protector completely covers the resident's buttocks and peri area. Expose the resident by lowering the top sheet to just above knee level and raising the gown to hip level. Prep your first washcloth by wetting it and squeezing it out. Completely open the washcloth and apply a generous amount of soap to all areas of the washcloth. Rub the washcloth together to produce a good lather. Fold the washcloth into fourths. Critical element step. Secure the catheter at the meatus. Wrap the washcloth around the entire diameter of the catheter. Critical element step. Clean in a downwards motion at least 4 inches of the catheter. Critical element step. Do not tug or pull on the catheter. Prepare your second washcloth by wetting it. Do not apply soap to this washcloth. Secure the catheter at the meatus. Wrap the washcloth around the entire diameter of the catheter and clean in a downwards motion without tugging or pulling on the catheter at least 4 inches. The third washcloth will be used to dry the catheter. Secure the catheter at the meatus. Wrap the washcloth around the entire diameter of the catheter and dry in a downwards motion at least 4 inches of the catheter without tugging or pulling on the catheter. Remove the soiled linen protector. You may do so by raising the resident's hips or turning the resident onto their side. Ensure that the soiled linen protector does not come in contact with your clothing. Recover the resident by pulling the resident's gown down and raising the sheet to chest level. Appropriately dispose of the soiled linen protector. If you used a chucks pad, dispose of it into the waste bin. If you used a towel, dispose of it into the soiled linen hamper. Dispose of all other soiled linen into the soiled linen hamper. Return the soap to storage. Empty the basin in the sink. Rinse the basin. Empty the rinse into the sink. Dry the basin. Ensure that the basin is completely dry. Return the basin to storage. Remove the clean barrier and appropriately dispose of it. If you used a chucks pad, dispose of it into the waste bin. If you used a towel, dispose of it into the soiled linen hamper. Remove your gloves without contaminating yourself. Then dispose of them into the waste bin. Apply hand sanitizer to your hands and rub your hands together until they are completely dry. Return the overbed table. Straighten the resident's sheets. If raised, lower the bed to a low safe position. Ensure that the bed wheels remain locked, and ensure that the call light is within the resident's reach. Ask the resident if they want their privacy curtain to remain closed or open. Ask the resident about their preferences. Remove any wrist, hand, or finger jewelry. Turn on both handles. If your sink has only one handle, turn that handle to the center setting. Wet wrist, hands, and fingers. To remove excess water, lightly tap hands together. Apply a generous amount of soap to hands and begin lathering. Critical element step. You must lather hands for at least 20 seconds. Ensure that your hands remain below the level of your elbows with fingertips down. Critical element step. Do not allow your hands to touch the insides of the sink. After lathering hands for at least 20 seconds, clean underneath fingernails by rubbing the fingertips against the opposite palm. Don't forget to clean under your thumbnail. Thoroughly rinse all soap from wrist, hands, and fingers, ensuring that your hands remain below the level of your elbows with fingertips down. Critical element step. Do not allow your hands to touch the insides of the sink. Dry hands, beginning with drying each individual finger of each hand first. Dry remaining areas of wrist, hands, and fingers, disposing of the paper towel after each use. You may use as many paper towels as necessary to ensure your hands are completely dry. Use a clean, dry paper towel to turn off the sink. Critical element step. Do not crumple the paper towel in your hands. State skill complete.